Imaging is not the end-all be-all. What matters is how you feel, and what's more important than getting imaging is listening to your body and doing the things that make your body feel better so that you can go do the things that you enjoy in life that keep you happy without fear of hurting your back. Before we look at my imaging and my reports, I want to tell you that I haven't compared whether it's gotten better or worse over the last decade. So, 2009, I was around the low point of my back pain problems. 24 years old, yeah, that's when I committed my life to forgetting about all this stuff, doctors, and finding somebody else to solve my problem, and I decided that I was going to have to do it. So this was my doctor report. Severe lower back pain. If you look down at the bottom here, lower back pain radiating down the left anterior thigh and into my buttocks. So I was having basically sciatica or radicular pain. Now, at this point, I was not really able to surf or do things that were fun. So we're going to go to 2013 now. Moderate disc degeneration at L4-5. There's a 3 millimeter bulge or protrusion and moderate stenosis. L5-S1, moderate disc degeneration as well, disc space narrowing and desiccation. There's a 2 millimeter disc extrusion, which would be a herniation, and prolapse, also herniation. All right, so let's take a look at my images. This, which you may have already seen, the most recent image of my spine, and this is an x-ray, so you can't see the soft tissues as well, but you can see the bone, and you can see here that there is, I would call this, I don't know, moderate to severe stenosis, or maybe they would call it moderate. In the report, which I'll show you, they called it moderate, and also a listhesis. I did a kind of an exciting thing with these images. This was kind of where I let my body kind of relax into what one might call just like a poor posture, or not trying to connect to my core or connect to my anchors. And this is what my spine looked like when I did that. But then I asked the medical technician to take another image of my spine where I was connecting to my anchors, core balance training, my core, right? And she took another image, and this is the same 2 minutes later, same body, same spine, and I'm connecting to my anchors, as we call it. And you can see what happens to my spine. You can see that the space actually increased between my L5 and my S1. This is your sacrum here. I should have pointed that out before. This is the sacrum, and it goes down into the tailbone, coccyx right there. And this is the L5. You can see there's more space, and they're more in better alignment compared with this image where it appears that they're actually touching here and they're not in alignment. So the edge of the L5 is over here and the edge of the sacrum is here. So there's some overlap here, which you would call a listhesis. In this case, it's a retrolisthesis. So this is just like my belly is, hanging out a little bit. I'm just kind of like totally let go of my posture. And this was just a gentle connection to my anchors. I get better alignment. Here's the edge of L5, right in line with the edge of the sacrum, and I have more space between the vertebrae. People ask for evidence from us. If this can be evidence to anyone that posture matters and that core connection matters, and it does have an impact on the alignment of your spine, and if you can believe that, then I don't think it's a big leap to say that this is out of alignment and that would cause increased wear and tear on the discs. I think most people can believe that the door hinge that's in alignment is going to function longer and better than a door hinge that's out of alignment. It's going to wear down quicker. So to me, this is logic. Believe it or not, guys, there's a lot of people out there that I call them the naysayers. They don't believe that posture matters. If this is not enough evidence for you, then I don't know what is. And I did one more thing that I thought was pretty interesting and exciting during this x-ray exam. I asked them to take one more image of me, and instead of connecting to my anchors and that type of core engagement that we teach in the program, I did a different type of core engagement that they teach in other disciplines, where you bring your belly button towards your spine, and I call it abdominal hollowing, pulling in your stomach, and they say pull the belly button in. So I did that, and this is the image of that. You can see that I'm pulling my belly button in, and you can see what happens to my spine. So what I noticed here is that my spine lost its curvature. It looks straight here, and then the sacrum is kind of a kink in the spine. It goes straight down, and then there's a hinge here, and there's not increased space between the vertebrae, between L5 and the sacrum, and it's not in alignment. You can see L5, the edge is clearly right here, and the edge of the sacrum is here. And so it's just, to me, it's visual evidence of what is happening with a healthy brace, where you maintain the curvature of your spine, and you have space between the vertebrae, and what I would consider an unnatural type of core engagement. And they teach this in certain disciplines. I'm not even going to name the disciplines, but you have heard of pull your tummy in or pull your belly button to your spine. And this is what happened in my body. Maybe it's different for somebody else's body, but it doesn't look like a natural curvature of the spine. And it didn't fix the problem that I had with just like my belly protruding out type of posture. We're going to go to my MRI. The vertebral body is normal morphology, alignment and intensity. The evaluable elements of the neural arc appear normal. There's a disc bulge at L4-5, a disc bulge at L5-S1, a decrease in foraminal space, so that's a stenosis at L4-5 and L5-S1, and everything else is normal. So what I found to be interesting about this is, and now that we've already looked back at my previous reports from 10 years ago, is there hasn't been much change to my spine over the period of a decade. And also these reports, these results that I have from a week and a half ago would be considered normal for someone in my age group, age 37, approaching 40. Disc bulges would be considered normal. A little bit of stenosis would be maybe not normal, but not too uncommon. So for my age range, I've kind of become a more normal person, whereas in my early 20s, when I was 23 years old, I had more advanced degeneration and bulging and herniation, and it actually appears that my L5-S1 disc is no longer a herniation, it's actually a bulge. And so that you could argue that I may have even experienced some improvement over the last decade. And the message I want to send to you guys is, I didn't do anything in the medical system over the last decade. All I did was I improved my relationship with my body and my core. I felt that that was the most important thing to me, and it turns out when you have re-entered the medical system this past couple of weeks, it turns out it's potentially improved or even just maintained my spine from a radiological perspective over a period of a decade. And you got to remember that I had a lot of damage happen. I was on a downward slope from age 16 to 24. I did a lot of damage, and then somehow it's kind of leveled off. No matter what my imaging says from a week and a half ago, I can say that I've lived my life to the extent that I want over the last 10 years. And that's what's important. The only reason I got this imaging is because I'm going to be, and this is kind of an announcement, I'm going to be using myself as a little bit of a guinea pig and testing out stem cell therapy to see if it's possible that it can regenerate spinal discs. The reason they reached out to me, I really appreciated this about the clinics. They wanted their patients to, after they get stem cell treatment, to do the best thing for their spine, because obviously they believe that it's important what you do after the stem cell injections that could help support the healing. And they thought that core balance training would be a good thing for them to do, and that's why they reached out. And so I'm going to be doing that and give myself the best chance of regenerating some discs. We'll see if we can. We looked at my imaging, we looked at my reports of my spine, and it wasn't pretty. There were serious problems with my spine, and that could potentially have a major psychological impact on me. So, man, I have spondy, I've got stenosis, I've got bulging disc, I got degenerative disc disease, my spine is kind of broken. Maybe I shouldn't be doing all these fun things and these extreme activities in my life. Maybe I should take it easy. And that psychological impact can lead to a spiral of what we call not participating in life, lack of participation in the things that you do. And so I just really want to emphasize that imaging is not the end-all be-all. What matters is how you feel, and what's more important than getting imaging is listening to your body and doing the things that make your body feel better so that you can go do the things that you enjoy in life that keep you happy without fear of hurting your back. And that's huge, because doing those things that you enjoy but fearing hurting yourself while doing them is not a way to enjoy life. You want to be able to feel confident in the things that you're doing, and you want to be able to do them. And that's what's the most important thing. And the path to doing that involves listening to your body. I've talked a lot about that in the past, is a very big responsibility, and it's much more than just hearing pain or not hearing pain. It's an active process, and responding to your body appropriately and continuing to have that conversation, that fluid dance of listening to your body never stops. Keep doing the things that help, that seem to make you feel better, and build on that. With that said, I'm signing off. Thank you all for being here, and until next time, get down on the floor and connect to your core. Take care, everyone.